Hi, this is Michael Grimes. I am here with Melissa Palmer. We are here today to discuss her personal experience with breast cancer. Hello, Melissa. Can you tell us a little bit about your breast cancer story?
Hi, Mike, and thank you so much for interviewing me today. And really, this is something I never discuss. Uh, Basically, I'm 43 years old right now, and at 40, I had a surprise birthday party that was thrown by my husband, Dr. Sean Palmer, and it was wonderful. And I thought, what comes with turning 40? And guess what? A mammogram. So, my birthday's in September. I'm a Virgo. And in July, I started thinking about, well, I better get my mammogram before I'm 41. And I had 3 children with my husband later on in life. I had my first child at 21, and then the 3 in my 30s. So my last child I had at 36, I was advanced maternal age. And I had a scare where I felt something I was pumping because the baby had some health issues, and I felt like a cyst. So I did have an ultrasound on my right breast, and it was normal. But when, I don't know what it was that July day, I started thinking about, okay, I don't do self-exams, I need to start. So I took a bath and I started with my left breast, and I felt gravel. Not a lump, it felt like a pebble gravel. And my mother, who spent her life in the operating room as a registered nurse, always said to me, when you feel gravel, you know it's cancer. So my husband Sean and I had some plans to go away over the weekend, and I wasn't going to tell him. But I did scream for my best friend Laura. She was my nanny as well. I also have a rare form of muscular dystrophy called Pompe's disease. So I get tired easily, and I'm in and out of the hospital every other week. So I screamed for Laura, and I said, Laura, come here. I said, I feel gravel. Do you feel this? And I said, I'm not weird or anything, but I really, really feel gravel. And again, it was a Thursday. She felt it. She said, I absolutely feel it too. She said, you need to call your husband. My husband was seeing patients as an orthopedic surgeon. He came home. He said, don't worry about it. I'll come home. I'll check it out. And it's fine. So he came home and he felt it. And I heard him in the office saying, yes, she'll be in at 10 a.m. the next day, to a general surgeon who he's friends with, Dr. Rachel Bear. So I said, okay. So I went with my brother, and I met my husband at Dr. Rachel Bear's office, and she took the ultrasound wand, and I saw the look on her face. And I said, is it cancer? And she said, well, I can't say that it's not cancer. And she said, I just can't say that it's not cancer. I said, well, when will I get the results? I was very nervous. Of course, it was Friday. Pathology is closed. You don't get the results till Monday. She said, sometime Monday. So I looked at my cell phone Monday morning, and I really wasn't thinking about it. I thought about it over the weekend maybe a couple of times. And I looked at my cell phone, and one of my daughter Taylor's friends texted me, I'm so sorry, Mrs. Palmer, about your breast cancer. So I immediately dialed my husband's office, and they said he had left with my daughter Taylor. And I knew that I had breast cancer. And just like anything in medicine with me, so confusing. Because I have muscular dystrophy and I'm in the hospital every other week for life-saving treatment, chemo is a big issue. Now, there is a new test called an oncotype test, which measures the aggressiveness of the tumor, and we were waiting on the oncotype results. So it took about 2 weeks, and it was 1 to 18 is no chemo. But since I was 40, they would have had me do chemo. And then 19 to, I think it is 30 is the moderate range, and 30 to 100 is the yes chemo range. Well, I came in at a 22. So I talked to the doctor. She said she didn't know. She was going to have a board meeting with the hospital staff next week. They do it every single month on the hard cases, and I was definitely a hard case. No one really hears about Pompei's disease, so the fact that I had the dual diagnosis was so confusing. And every single doctor, about 50 of them we knew, were asked, what would you do with someone who's already struggling with muscle disease? Would you give them chemo that damages their muscles and take them off treatment, which Pompei's disease, being off treatment, could cause a lot more problems? So, and absolutely no doctor wanted to take ownership of it. We didn't get a straight answer, but out of the 50 doctors, they all said they wouldn't do chemo. So I went and I saw world-renowned doctor at Northwestern, Dr. Gradishar, and he said, no chemo. With what I was dealing with, the quality of life that I had, I'm a mother of 5, again, wife of a surgeon, and we decided that we were going to do radiation, stick with the muscular dystrophy treatments, and do a lumpectomy. So we did that, and it was the hardest time of my life. It was harder than when I got diagnosed with my Pompei's disease, which is much worse. It's much more aggressive, and it's a terminal illness. There's something about, I felt like my sexuality with breast cancer. I didn't feel womanly, and then I started on the tamoxifen during radiation, which is the anti-cancer drug, and it made me feel so bad. It puts you into menopause, and I really felt like I didn't have anyone to talk to. And it was really hard on my marriage. It was a hard time. So, after I finished the radiation, I waited about 3 months, and I started a cancer foundation. I'm a therapist. I have my master's in counseling. There was not a wellness center in the community, Barrington, Illinois, where we lived. So I decided with a friend to start a wellness center called Cancer Cell Survivors. And we met. We had some fabulous moments. We went out, we had support group meetings, we made baskets for people fighting cancer, we had a food program. Everybody fighting cancer would get 4 weeks of grocery gift cards, as well as paper towels and vitamin juice. And then I got involved with the American Cancer Society, and I was queen 1 year. I was the top fundraiser for 2 years in a row. And I decided to donate Cancer Cell Survivors to Advocate Good Shepherd Hospital. But looking back, I don't think I got the help that I should have. I think that it is very hard once you're a cancer survivor. And I had another illness to fight, and again, it's been very hard on my marriage. I still get teary-eyed a lot about certain cancer situations. When we had our Relay for Life team, we had 5 people on it. One person passed away, a mother of 4. It really hit me hard. I babysat her kids, and I still am very involved with philanthropy and cancer, but breast cancer is hard, and I encourage everybody to go get therapy because it does. It affects your sexuality. The medicine tamoxifen puts you right into menopause, which affects your personality. And I had some really rough times, and I still do. It affects you forever. Now, the biggest blessing about my case of breast cancer was that I was BRCA negative. I do not know why I was in that 1% population that got breast cancer. I'll never know, but I'm so glad because it would have affected my daughters. And I have 3 daughters, and I love them more than anything. And the thought of being BRCA positive would have been so hard. So I think really the 3 tips for survivorship after you get breast cancer is 1, to go get therapy. And go get therapy to someone who specializes in rebuilding your life after you have cancer. For me, I wrote a book. I started my own foundation, Cancer Soul Survivors. I wrote part-time when I could. As a mother of 5, I'm sure you can imagine how busy you are. And then doing all the philanthropy and babysitting, I think, is the second tip of being involved in philanthropy. And the 3rd tip is being with God and your loved ones, because you need that support. You need that support. I remember so many times my husband saying, I don't want to talk about this. I needed to talk about it with someone, and you need someone there. And it's a very hard experience, and I will help any soul sister with breast cancer that needs anything as a friend. And again, please reach out to me if you need anything. So thank you for watching this. I think this is the 2nd time I've had a chance to talk about my specific case and how I did it. And I don't really think I went through everything the way I should have, because I didn't focus on myself. And I think I dug into work, and it just didn't do my husband and I justice. So thank you again, Michael Grimes, for the interview. And we're all survivors of something. Breast cancer is so prevalent. It'll affect someone you know sometime in your life. Thank you.